And today we are going to talk about an extremely common health issue, which is the problem of the stained teeth. A very good morning. I am Dr. Shweta Mathur Lal from Apollo Hospital, Noida. These stained teeth can occur in all human beings due to many reasons. But the most common reasons is definitely having colored or additives in the food. Certain food items which like coffee, pomegranate are naturally staining products, but can also have these stains as intrinsic stains which occur congenitally or due to some other problems. Intrinsic stains can be in the form of fluorosis. It can be due to a trauma where the tooth has become discolored, or it can also be due to certain enamel defects. In these cases, any modality to lighten the shade of the tooth may not occur. But we can help all our patients who have stained teeth due to certain food items and which are extrinsic stains. This can be brought about by a treatment called the tooth bleaching. Now, bleaching has come a long way in dentistry, and it tends to lighten your tooth 2 to 3 shades lighter than the original or the desired tooth color. Now, this bleaching can now be done most effectively by lasers. Laser-assisted tooth bleaching is a process that hastens the process on the dental chair. It brings about accentuated action between the bleaching agent and the enamel surface, thereby reducing the chair time, firstly. Secondly, thereby reducing the sensitivity that is associated with post-bleaching, and also a better finish. Now, why sensitivity is controlled by laser-assisted bleaching is because lasers are naturally dental tubule sealers and they fight sensitivity. Also, the reaction time of the bleaching agent and the tooth surface is grossly reduced, and therefore sensitivity doesn't really occur. Tooth bleaching is a beautiful way of enhancing your smile. Intrinsic stains, however, can be treated by other modalities like crowns, veneers, and can be taken care of as well. So the stained teeth should not be a stain on your smile. Keep smiling.